You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. My guest is Dr. Kenneth Krauss. Dr. Krauss, welcome to the program.
Thank you.
Let's start. In your practice, who's coming in for dental implants? Like, what are the different types of categories if you had to categorize them?
Well, people who are losing their teeth, people who are suffering with dentures and partials, people who have lost teeth in accidents, people who have teeth are failing, teeth that are fractured from root canal treatments, and just other problems in general. But
okay.
Yeah.
So you have a concept where you pretty much do everything right there. I guess how it's normally done, and correct me if I'm wrong, that when you get dental implants, normally you go to maybe the surgeon that does the implants.
Right.
Then you go to another dentist that puts the teeth on top.
Correct.
And maybe somewhere else for the imaging. But you do it all right there.
That's right.
So aside from convenience doing it all right there, what's the big advantage for the patient?
One of the biggest advantages really are time, because they're not shuttled back and forth between practices, and there's not a miscommunication, and we have a handle on what's going on from start to finish, so we can see the case all the way through with the end in mind to have a beautiful outcome.
So moving on to today's topic about dental implants, what are the different categories of implant patients that you see?
Well, like I said earlier, the people who are losing their teeth would be one of the primary categories, or people who are wearing dentures or partials. And those people would be the ones that can understand what I'm talking about the most.
Are there a lot of denture wearers in Bakersfield? Like wearing an upper or lower denture?
Literally, you could fill all the high school stadiums in Bakersfield with denture wearers. And I'm not being critical of Bakersfield, but that could really actually be anywhere. And
really?
Yeah. So that's not pointing a finger at...
So it's common.
Yeah, so I'm not trying to make a joke of the place that I live.
Yeah.
Yeah, but this problem, and that's the thing that denture wearers need to know, is that they're not alone, that this is a common problem that people have everywhere, and that they don't have to live like that. So my dad was that guy.
So he wore dentures?
Yeah. So my dad was that guy that, and I can remember that he suffered, dealt with gum disease. So gum disease is, bleeding gums, the teeth are getting loose, bad breath, all of those things.
Okay.
And then, so eventually he ended up, getting dentures. And
did he get a denture while you were already a dentist?
No, it was before.
Before that, okay.
Yeah, so it was before. And I just remember that he struggled with it. So he had a hard time eating certain things. You're always dealing with, things not fitting right, getting sore spots and needing adjustments. And, anything that's in your mouth that's moving around is going to cause these problems. And he had all of these problems. And so I hated seeing him going through that, and I'd hate to see that other people go through that. And I know there's a remedy. I know that the problem can be solved. I remember my grandfather, even going back, a World War II vet. He went into the Army and he said, I had some teeth that need to be fixed. He said, well, you're probably not going to live. We're just going to pull your teeth out. And so anyways, he wound up having dentures. And back then, the option to even have implants for dentures weren't even available. But now, I'm thinking if my grandfather were alive today, or my dad, they'd have the option to have teeth that were fixed in place with implants that didn't come in or out, and they wouldn't have to deal with worrying about, are they going to pop out when I'm talking? Or are they worried about...
Do they really worry about that? I mean, denture wearers? Do they tell you that?
So one of the first implant cases that I did years and years ago, had my uncle come in from out of state. He said, I really want to get this promotion at work. And he goes, and I got this new position at church where I have to do all the speaking in front of this whole, group of 300 or 400 people. And he goes, one of my biggest fears is I'm going to be talking and the denture is going to fly out. So with my uncle, we placed 4 implants that allowed the denture to snap in and stay in place. And because of that, he felt comfortable being able to speak at church. He also got the promotion that he wanted to get on his job, and he never stops thanking me. Every time he talks to me or sees me, he's like, Ken, he goes, I'm really, I'm grateful that you did, you're able to do that for me. And In fact,
and
also,
what can they eat with something like that? Like with a snap-in, locked-in denture, a full set of teeth, what can they eat?
you know, I was telling him, I said, you know, you can probably, once you get used to these, you probably could eat glass, but I wouldn't recommend it,
Okay.
all right, because you're probably going to break the teeth. But quite literally, he said that he was almost pretty much felt like he's back to full function, you know, meaning that he felt like he could eat almost anything. Like he felt like his life was, you know, as far as his teeth goes, like he was back to normal. He was restored, and that was a complete change for him in his life.
So backing up though, because you said you could fill up all these high school football stadiums with denture wearers. If it's so good to go in and get either a permanent fixed set of teeth supported by dental implants, why aren't they all doing it? What's your take on that?
Well, if you think about it, if you're a denture wearer, who are you not seeing usually?
The dentist.
You're usually not going in to see the dentist.
Okay.
So since you haven't been to the dentist in years, you're usually going to go in when you start having a problem with the denture. And if you're lucky, you'll go somewhere where somebody will give you options, where they can tell you, okay, you know, did you know that you could do this? And give you a vision and a way to do it. But most people, you know, they'll go in, they just want to get the denture taken care of, to get it relined.
So they don't know their options. Is that what you're saying?
So many people just don't even know their options. They don't even know it's possible. They don't even know they don't even really know what's available or how to go about it. So somebody needs to take these people by the hand, more or less, and lead them through the process and explain to them how they can go about changing their life.
But is this true that in one day and one afternoon, I mean, they could come in without teeth
Yes.
and walk out with full arch of teeth on the upper and lower, they don't come in and out?
That's very possible. So with as little as 4 or more implants, they can leave with a full arch of upper and lower teeth. You know, in other words, a full set of teeth.
How soon can they eat after the procedure?
You should be able to eat right away, but you don't want to be too aggressive right at first, because you're just the main thing is you're just getting used to it because it's new. But it doesn't take, you know, too much time before you start getting into a normal diet.
What could they eat? Like if you have a fixed upper and lower set of teeth, could they bite like apples with their front teeth or like corn on the cob?
When everything is going, I mean, yeah, you can eat anything, you know. You can eat glass. I wouldn't recommend it, all right?
So they're that strong.
Yes, right. In fact, yeah, I mean, for all intents and purposes, I mean, you're full function.
Okay, good.
Right.
Now, what about the other group of people? They have teeth, but those teeth are like ready to fall out.
Right.
And they have bleeding gums, and as you say, bad breath and loose teeth and all that stuff. Are they too far gone to get this procedure? I mean,
no.
Are their gums too bad, is what I'm asking?
Well, you got to understand that it's gum disease, but what are we putting the implants in? The implants are not going in the gums. The implants are going into the bone underneath. So it has nothing to do with the gums. It has everything to do with the bone, and that's where the implants go. So no, those people, not only are they not far gone, those people are some of the biggest beneficiaries of this process, of having implants. In fact, not only do they need it, and not only do they benefit from it, but they absolutely love it, and they love the outcome, because part of it is not because they are not able just to eat, but they hate their smile, they hate being around people, they aren't able to be who they really are, they're not able to express themselves, and you're literally changing that almost overnight. So there was an old cowboy that came to see me. He was well into his years, and he had been dealing with dentures for years, and he finally came to me and said, Dr. Krauss, what can you do? So we did similarly a treatment like we did for my uncle, where he had snap-in dentures. Now, he was one of these guys who was really serious all the time.
Okay.
And you weren't really sure what he was thinking, and he didn't seem unhappy, but he didn't seem happy. And so we did the treatment for him. He seemed to be satisfied. And then a couple weeks afterwards, they said, so-and-so is out to see you in the waiting room. They want to talk to you. And I thought, well, my first thought was, okay, he's upset about something.
Yeah.
He came out, or I went out there, he shook my hand, looked me in the eye and smiled and said, this has been one of the greatest things I've ever done for myself. He said, Dr. Krauss, I'm satisfied 110% with this. And he goes, I'm so grateful that I did this. And he was very pleased. He was just one of those type of people that was a little more serious, and he didn't show a lot of emotion or expression. But the fact that he came back like that tells me what he really thought. And it literally changed his life.
How old can you be to get the procedure?
You can be, 80, 90, 100 years old. I mean, I've had many patients who are 80 years old.
So why would an 80-year-old want to do this?
For the same reasons that you would want to do it, Randy, because you want to eat and chew and enjoy life, just like everybody else. So it reminds me of a patient I had back in dental school. She was 94 years old. Her name was Mary. And she said, and like I said, I was just a dental student. And she said, Dr. Krauss, I want to whiten my teeth. And I'm thinking to myself, well, you're 94 years old. So I actually went to the instructor and I said, well, this 94-year-old wants to whiten her teeth. And he says, and go whiten her teeth, because that's what she wants, all right? Because that was important to her, all right? And what did that teach me? It doesn't matter. 94, 74, 24, any age, all right?
But you definitely believe, though, that nobody, like in Bakersfield, that nobody should be wearing a loose-fitting denture, that everybody should have it attached to something.
Why?
Right?
Why do they need to? The technology is there. It's possible to be done. So really, it's just a decision to do it. You just have to go.
Are they afraid? Is that what it is? I mean, is that why they're all not coming in? Because look, I guess if you're wearing a denture, you went through a lot.
We talked about that, right?
Yeah.
So patients who are wearing dentures, typically, they're not going into the dentist, right? So they don't know. I mean, it could have been 10, 15 years before they've gone anywhere. And so they just don't know it's available. And maybe they went somewhere that didn't do implants. Maybe they went somewhere where they were afraid to talk to them about it. Maybe somebody judged them and said, well, they seem to be happy with how they are, kind of like I judged Mary, the 94-year-old. And so they're not going to bring that topic up to them, when in reality, maybe they would have been open to it.
You brought some photos. What are we looking at?
So when this lady came to see me, she was worried about her smile. She didn't like the way her teeth looked, and she knew she had to do something about it. And so the teeth that you're looking at right here in the photograph are all supported by dental implants. And we're able to go in and save the day, as it were. And now you see the result. You see a beautiful smile.
So she was actually headed for a denture. Like, she would have been wearing a denture.
Oh, most definitely. So this is a case where the patient had teeth, but the teeth were in trouble. And we were able to go in.
So they had to be extracted.
They had to be extracted. If she hadn't done anything about it, she would end up in a denture or a partial, but we were able to save her. So this is crown and bridge, and she's happy, and it looks beautiful. Don't you agree?
Yeah. So those don't come in and out.
Those do not come in and out.
Those are fixed.
Those are fixed.
Is that what people want? I mean, they want.
Well, of course
obviously
they do.
You have a snap in, snap out option.
Right.
But it seems like everybody would want permanent teeth that don't come in and out.
That's what most people would rather have. They would rather have teeth that don't come in and out. I mean, if you think about it, a denture, an upper denture, is going to cover the roof of your mouth. Think about that.
Yeah.
If you took wax and put it all over the top of your mouth right now, you wouldn't be able to taste your food. And not only that, but you have this big old chunk of stuff, this foreign object, as it were, to get used to, for your tongue to get used to in a way. Yeah, the plastic, the acrylic, whatever that's in the way there. And back to this gal right here, she loves it. I mean, she is very grateful and thanks me every time that she sees me that she was able to do this. And she's so happy that she not only can function and doesn't have any more pain, but that it looks good. And she's very proud of it.
When you say function, what do you mean?
To eat and chew and live normally, and just like anybody else that has her teeth, and not worry about it. So now she's not in pain. She loves the way it looks, and it just works and functions normally. Because the last thing you want to do is be like thinking or worrying about it, okay?
So these people with really bad teeth, their whole life revolves around their teeth, or especially with denture errors, you got to clean them, you got to worry about them.
Well, like I was telling you about the example of my uncle, like they don't want to get up and talk in front of people, or let's say somebody is a school teacher and they're talking in front of a bunch of kids. Or the one that I hear a lot is somebody who's like working around young kids, all right? Like 3, 4, and 5-year-olds, and they'll say, you know what, hey, teacher, I see, how come your teeth are all crooked or look bad? And, because kids are just honest, right? They're not like us where we can filter it and we can, and they're just children. And so, these patients, they hate that. They don't, they want to do something about it.
So this is your third set of teeth, you called it.
This is your potential to have a third set of teeth. That's right.
So there's a lot of people in Bakersfield, I guess here in San Diego, across the country, that hate their
Everywhere.
teeth, right? Now you said something interesting in the green room, that people with bad teeth are discriminated against. What do you mean? Elaborate.
Well, why would my uncle say, I need to get my teeth taken care of to get that promotion at work? Why would he say that unless he felt like that he sensed that getting that done was going to make a difference for him, which, by the way, it did. Because people, when they intuitively see us and they see a problem, like, what if I was on the show right now and I was just missing one of my front teeth?
Yeah.
Okay? So the first thing you do is you tell me, Dr. Krauss, before you come on my show, you need to get your tooth taken care of, right? Because you're not going to have any credibility.
All right.
Okay? So by the same token, any of these people, if they have problems with their teeth,
like really bad teeth, people might think they're poor or something.
Yeah, even though they're not, there might be just other reasons or other things that are holding them back. And they can be wonderful people. And everybody that knows them loves them. And we know who they are, right? We aren't supposed to judge a book by its cover, right? That's what we're taught. But you get in these situations, where you're going for a job promotion or going for a job or, whatever the case may be. And unfortunately, the way the world is, you're going to get judged by that.
Well, a smile goes a long way, right?
Right, but I mean, fortunately, unfortunately, that's the way you're going to be judged. And so people are going to view people who have a problem like that, that they're, like you said, that they're not able to get things done, they don't care about themselves, or,
But it's all not true, as you say. That means they're, just because they have bad teeth, you said some of these people are brushing and gargling and...
Well, I think of the example of my dad. I mean, I remember he was always brushing and taking care of his teeth. But, back in those days, they didn't have the technology to treat and take care of gum disease like they do now. And once these problems set in with people, once you have gum disease, and it gets to a certain point, there's nothing you can do about it.
So people hang on to their teeth for too long. Would you say that? That means there's a lot of people that have been told your teeth have to go and they just keep them in their mouth. Is it the fear of the dentist? Because nobody likes going to the dentist, right? You must hear that.
Right. Well, we hear it all the time that people don't like going to the dentist because of just different reasons, things that have happened in childhood or whatever the case may be. But, with these people who are losing their teeth, it got to a point where you could say it was a point of no return. And when you get to that point, it's not possible to save them anymore.
So it's either dentures or getting permanent set of teeth with dental implants.
Or the people who wear the dentures, who maybe somebody's gotten to that point where they're in the dentures and they can get dental implants and get their dentures secured. So either one, either group. Here's another patient, Randy.
All right.
And this is Chris. So here's a guy right here with just a few implants placed, has a full set of upper teeth, and he can eat pretty much anything now. No limitations. Bite into a steak, bite into an apple. Let me show you this other patient.
All right.
Okay. Beautiful set of teeth, right?
Okay. Yeah.
So here's the thing I want to emphasize. If you're wearing a denture or if your teeth are in trouble, you're not going to be able to eat right. And it's definitely going to affect your life. And so when I say that someone's in full function, when we use that term, what we're implying is they can eat pretty much anything they want. They can eat nuts, they can eat salad, all
like
the
you
things.
And I mean, we don't have to think about what we're going to eat, other than it has to fit in our diet.
Could you imagine if you were right now, if all of a sudden you were limited on what you can eat because of your teeth, because it would hurt to eat, because even if you had, if your teeth were aching or if your teeth were, not secure, or if you're worried about your teeth falling out, or you just couldn't eat, in general, how would that affect you?
Yeah, it's terrible.
I mean, it is. It's horrible. And so now we're basically reestablishing that for these people and giving them that new lease on life, as it were, so they can eat and chew and do all the things that we take for granted.
So what about pain? Seems very painful.
you know, during the procedure, they're not going to feel anything. Whatever is needed to be done, we'll do. Sedation is offered, in some cases IV sedation. We have some patients that, you know, for them it may seem like it was only a couple minutes, and we've placed several implants all at one time. And you know, the thing is that people are surprised afterwards actually how little pain there is afterwards with implants compared to other procedures they have. And this doesn't apply in all cases, but in many cases people are very surprised that it wasn't more, you know, they didn't have more problems afterwards. You know, so everybody's different on how they respond and, you know, how they react to pain and how things are afterwards. But most people are very surprised.
I guess your challenge with the, because you say there's tens of thousands of denture wearers where you are in Bakersfield, but the challenge is getting them to come in.
Right.
Because of all the money they've spent, I guess, on their failing dentistry, and now they just ended up in dentures. Is that the problem? They just don't want, the last thing they want to do is see you, right?
This is true. So if you think about it, a lot of these people, and a lot of people can relate to this, is they spent years and years, you know, from their earliest memory, you know, going to get treatment, and it just keeps on going and going. And finally, at some point, they lost their teeth, and in some ways, it's a big relief. But then then the realization sets in later when they have the dentures, yes, it was good to be free of that problem, but now they have inherited a new problem.
And they just adapt.
A new set of problems. Yeah, after a while, you just adapt to it, right? Human beings are very adaptable. But the thing is that I see patient after patient who comes in, you know, and they come in with dentures, and what's their number one complaint? Their number one complaint is, I can't stand these things. I mean, people have had patients people have had dentures for 3 months, or people have had dentures for 30 years. And, you know, they come in and say, you know what? I've just put up with this for 30 years, and I'm sick of this, and I want to do something about it. And those people fit into that category. They were the people that had, you know, when we were, you know, you hear the story, you know, we didn't have means to really take care of things when I was young. My teeth went bad, you know, or just different reasons, or people who have rehabilitated themselves, you know, from illicit drugs and just other things that have come up in people's lives. And so all of these circumstances come into play, and, you know, they are happy when they get to that point where their teeth are removed, but when they do come in, like I said, it could have been just a few months ago, a year ago, 30 years ago, and they're like, Dr. Krauss, what can we do about this? I need to do something about this denture. I can't stand this
dental
anymore.
implants are the answer, in your opinion.
And dental implants, well, what other option is there? I mean, the dental implant connects the denture to the bone, and so it's stable, so it doesn't move. And so if you think about it, our teeth, they're held in by the bone. And the implants are a little different, but it's the same concept. So now they're stable.
And they can last for as long as you last.
Yeah, all things being equal, they can last forever. I mean, they're really actually not difficult to take care of. And, people love them.
So what do they like more? When you take a denture wearer and you give them teeth that they can eat and chew and all, are they happier about the eating part, or are they happier about the appearance?
And that's a really good question that you bring up, because people that come in that they're all they want is to be able to eat better. They're like, all I care about is to eat a taco. But let me tell you, they're very concerned about how that thing looks. So this is what I say to if somebody says, all I'm worried about function. If you look at a beautiful racehorse,
yeah,
it functions well and it looks beautiful,
okay,
right? So why can't you create function with beauty so that they go hand in hand, because they go together, right? And so these people that say, all I'm really worried about is function, well, they
being able to eat.
Yeah, they become converts to...
They enjoy their beautiful smile.
To having a nice smile at the same time. I mean, and whether they admit it to you or not at first, they, when they get the teeth in, what is the first thing they do? They don't say, hey, can you hand me a steak? Can we try that? Hand me the mirror, okay? They want to see how they look, all right? They're not even, they're not really worried about trying out food right away, their food. They want to see how they look.
And what are they?
And that's across the board. That's across the board, anybody, all right? any of these cases that I do, I'm going to make sure that the aesthetics, cosmetics, if you will, the way they look, I mean, that goes hand in hand with function. Now, I'm a cosmetic dentist, and I'm worried about cosmetics as much as I am about, missing teeth.
So they look real, because I always feel like
Yes.
I could spot a denture walking down the street.
Yes. So they look real. So this is life-changing for so many people. One story I like to think about is my father-in-law. He had a horrible partial. It looked horrible. He couldn't eat right. He couldn't stand it. And so, I said, you know what, let's take care of it. So we placed implants, gave him a new set of teeth. Well, the funny thing about it is that for a while, I don't even know if he does this still, he would actually reach up and try to reach out to take it out and go, oh my gosh, my teeth are there, they're permanent. And now, in fact, my mother-in-law says he'll be driving down the road and he'll look up in the rearview mirror and smile and look at himself. So the point of it is that, did that change his life for the better? Of course it did.
Sure, yeah.
And the fact of the matter is that, I could tell you story after story like that,
So that's typical. I mean, there's guys out there right now in Bakersfield with these partials that they hate, that in one afternoon, and I don't want to put words in your mouth, but in one afternoon, you could give them a full arch of fixed teeth that don't come in and out. It seems like they would all want to do it.
In many cases, that's possible. That's right.
But it seems like they would all want to do it. It's just the fear of the dentist, I guess.
I don't really know if it's fear of the dentist alone. I think it's just the fear of, in general, of just not knowing what can be done and how to go about it and who to see and the process.
Okay.
And I think it's just, I think it's all of the above.
But isn't it true that Medicare, Medicaid does not cover dental implants here in the U.S., and most insurances don't even cover the whole procedure? So what do you do for those people?
That's true, but financing options are available. Some people just pay for it, but there are ways of getting it taken care of, and there are ways of getting it financed. And we know how to do that. We know how to help you and walk you through that process. And this shouldn't stand in the way of you having the life and that you deserve to have, and being able to be healthy and being able to live the way that you should live.
We are out of time. Final message to somebody watching this. Their teeth maybe are crumbling, or they're headed to dentures.
Right.
The other group of people are currently wearing dentures. What do you say to them? Your final message.
At least come in and find out what your options are and find out what's possible. At least allow yourself to know what you can do instead of just being stuck with where you're at.
Well, thank you for coming back on the program.
All right.
Excellent stuff.
My
they can go to
pleasure.
your website, and do they get to meet you when they go in? You
Absolutely.
see all the patients?
For sure.
Okay, good. All right. You're watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.